Hi, Dr. Brown. So good to see you at ASRS.
Great to be here. Beautiful day in Sweden.
Exactly. Dr. Brown, what are the highlights of this year's meeting for you?
I think the highlights have been the case presentations and the interaction on both surgical and medical retina. We've had a couple of first presentations of some drugs that haven't worked, so that's unfortunate. But you got to keep trying in clinical trials if we're going to try to move the ball forward.
Dr. Brown, would you mind sharing your real-world experience with the new Optos RGB imaging with us?
Sure. The Optos RGB image is a game changer. You get so used to the green of the regular Optos that once you see the RGB, then you can't not see the green again. It really helps on peripheral retinal pathologies like finding holes in lattice. Makes a big difference for like Amy Scheffler, my partner, following melanotic lesions. And I think everybody's going to have it as a standard, and we won't be able to stand the old green anymore.
Dr. Brown, would you mind sharing your real-world experience with high-dose Eylea with us?
Sure. The 2 milligram of aflibercept is an amazing drug, but it requires dosing that is, for some patients, they can't come in enough for treatment.
Yeah.
It's not a magical drug. It's 2 more half-lives. And so for the average patient that has a half-life of 10 days or so, that's an extra 3 weeks on a treat and extend regimen. It's also really helpful in our tough South Texas diabetics, where some of the before all the anti-VEGF in the armamentarium wasn't enough to control them, but you're able to get those tougher patients under control.
Thank you so much, Dr. Brown. Enjoy the rest of ASRS.
No problem.
clinicianlink.ai